I'm really pleased today to be able to talk to you on this National Day of Reflection, thinking back over the past 12 months about the impact that COVID has had on our organisation, on our patients and our local communities. I think it's a really opportune moment for us just to stop and pause and think about some of the really difficult times that we've all been through over the past 12 months, and also to reflect on those who've been lost as part of this tragic pandemic that we've been dealing with. I know that many of you across the Health Board will have your own personal experiences of losing people to COVID. Our communities have been hugely affected by COVID, with a large proportion of the number of deaths in Wales being in our CTM area. So I know many of you will be living in communities that have been very significantly impacted by COVID, and as I said, will know family, friends, neighbours who have lost loved ones to this terrible infection. And I think it's really important we take the opportunity today to reflect on that and think about all those people in our communities and in our staff group who've been affected so much by this. It's also an opportunity to reflect on some of the things that have changed for us as a health board over the past 12 months. I think it's been a 12 months like none of us have ever experienced before in the NHS. And I've been hugely impressed since I joined in September about the way in which the organisation's reacted to the pandemic and gone about making sure that the services we provide are adapted and changed to cope with the really challenging times that we've been through. We've had some huge achievements as an organisation over the past 12 months in the way we've reacted. If you look at the speed at which we were able to get services reorganised to cope with the increasing demand from COVID patients, the way we've been able to increase our ITU capacity has been hugely essential to our response to the pandemic. The way we've been able to work with our procurement colleagues to get the necessary PPE and equipment in as quickly as possible to support the patients who needed it. The flexibility of all of our staff across the organisation in responding, whether they were in a directly COVID area or whether they were redeployed or came in to help in COVID areas, has been massively appreciated by us as an organisation. We were able to set up a new field hospital as Betty O'Seran, which took a huge amount of effort from everybody concerned, not just our clinical colleagues, but estates, IT, finance, procurement, everybody behind the scenes who made that happen and ensured that we had enough capacity to cope with recovering patients as they came through. You look at our colleagues in public health, who've done an enormous amount of work working with the local authorities to ensure we have our test and trace system in place and that we're able to get out there and proactively test patients who were symptomatic. That's made a massive difference in the way we've been able to respond. And more recently, how everybody's come to the fore and helped ensure the vaccination programme can be set up as quickly as possible to make sure we can roll out the vaccine to our most vulnerable people as quickly as possible. Everybody has just worked so hard, and I'm so proud of everything you've done, and we should be very grateful to all of you for the efforts you've made. But fundamentally, this is about individuals. This is about you as individual members of staff. It's about our patients. It's about those people in our communities. And it's really important we just take the time to reflect on the achievements of our organisation in responding and the great efforts we've made to care for our patients at these really difficult times, but also to recognise that many of our colleagues in our communities have experienced significant loss, and we need to support each other and look after each other as we go through this period of time. And hopefully, as things begin to ease, it become a bit more easy for everybody. But we should never forget that we've been through some significantly challenging times, and people have had some really terrible loss, and today is just an opportunity to stop and reflect on that. Thank you to everybody for all of your efforts over the past 12 months. It is really appreciated by us as a health board, and I hope you'll take the opportunity to talk and reflect with your colleagues today on this really important opportunity to think about all of those people who we've lost to COVID. Thank you.